Hi, my name is Dr. Jonathan Dresner, Director of the University of Washington Center for Sports Cardiology and Team Physician for the Seattle Seahawks. In this video, we're going to review a very important topic, recognition and management of sudden cardiac arrest in an athlete. While this training video is intended for sports medicine physicians and athletic trainers taking care of athletes at all levels, the information also applies to coaches, strength and conditioning professionals, and to any adult responsible for the health and safety of athletes during training and competition. Sudden cardiac arrest, or SCA, is the leading cause of sudden death in exercising athletes and usually associated with an underlying structural or electrical heart disorder. While SCA can occur during any sport, nearly 75% of all cases in young athletes occur in three sports: basketball, football, and soccer. Male and African American athletes are also at higher risk. SCA is typically caused by an abnormal heart rhythm called ventricular fibrillation, or VF, which is when the heart quivers and does not effectively pump blood from its chambers. The strongest predictor of survival is a short time interval from collapse to first shock or defibrillation. In fact, survival from SCA declines 10% every minute that defibrillation is delayed. Sudden cardiac arrest can be effectively treated through prompt recognition, early cardiopulmonary resuscitation or CPR, and early use of a defibrillator. Research has shown that having an automated external defibrillator, or AED, on-site at sporting facilities and in schools to treat SCA increases survival to over 80%. Every school, club, and organization that sponsors athletic activities should have a written emergency action plan to respond to a collapsed athlete with a cardiac emergency. An emergency action plan for SCA includes rescuers trained in CPR and the recognition of SCA, access to an AED, all staff awareness of the location of AEDs, and a means to activate the emergency medical services system. AEDs should be located on-site at athletic venues or accessible to use so they can be retrieved and used within 3 minutes of an athlete's collapse. The emergency response for SCA should be reviewed and rehearsed at least once annually by all individuals responsible for the care of an athlete during an emergency. A quick readiness check of the AED before each practice and game is also recommended. And before a game begins, the visiting medical staff should be informed of the emergency action plan during a medical timeout. Recognizing SCA is the first step towards effective management. However, most responders to a collapsed athlete will not be familiar with the signs of sudden cardiac arrest, and some features of SCA may actually distract a rescuer from proper recognition. Sports medicine professionals, coaches, and other anticipated first responders must maintain a high index of suspicion for SCA in any collapsed and unresponsive athlete. Signs of sudden cardiac arrest include having the eyes open and rolled back, brief seizure-like activity such as shaking or quivering, which occurs in 50% of athletes with SCA, gasping or agonal respirations that appear like chest and abdominal movements can also occur in the first minute after SCA and may be misinterpreted as normal breathing. Resuscitation can be delayed if sudden cardiac arrest is mistaken for a seizure or normal breathing. SCA can occur during exertion, at the transition from intense exertion to lower levels of exertion, such as walking after a short sprint or at a pause or timeout in the action. Management of sudden cardiac arrest begins with early recognition and activation of the emergency medical services system, or call 911, early CPR, early defibrillation, and early advanced life support.
DJ, you okay? You okay? Hey, we have a cardiac arrest. Go call 911, get the AED.
If a player collapses and is unresponsive to verbal stimuli, rescuers should call 911, begin chest compressions or hands-only CPR, and retrieve and apply an AED as soon as possible.
Okay, got a cardiac arrest.
Sudden cardiac arrest should be suspected in any collapsed and unresponsive athlete, especially if there is no trauma. Signs of sudden cardiac arrest include having the eyes open and rolled back, brief seizure-like activity that can be shaking, quivering, or twitching, and agonal gasping, which looks like periodic chest and abdominal movements.
The jersey or shirt should be cut and the chest exposed and dried. Medical professionals can check for a pulse but should be cautious that inaccurate assessment of a pulse can delay resuscitation. Hands-only CPR involves chest compressions at 100 compressions per minute, 2 inches in depth. All efforts should be made to minimize interruptions in chest compressions both before and after defibrillation.
Good. Stopping CPR, analyze the heart rhythm.
Chest compressions are temporarily stopped while the AED analyzes the heart rhythm. If the AED recommends a shock, rescuers should move away from touching the victim.
Shock recommended, stand clear.
Many AEDs are fully automated and will deliver a shock without the rescuer pressing a button. Other AEDs require the rescuer to press the shock button. Once a shock is delivered, chest compressions should restart immediately.
Good. Back to chest compressions.
CPR should continue until the victim becomes responsive. The AED will reanalyze the heart rhythm in 2 minutes. Once EMS arrives, rescuers can assist in the transfer of care and more advanced life support as needed.
Ready to go?
Yep.
1, 2, 3.
Perfect. Let's roll.
Jack, you okay? Hey, go get the AED, call 911, tell them it looks like we have a cardiac arrest.
A football athlete wearing full pads and a helmet who suffers sudden cardiac arrest presents additional challenges for an effective resuscitation. If an athlete is suspected to be an SCA, opening of the shoulder pads and helmet to allow access to the chest and airway and facilitate a rapid resuscitation is the priority. The following steps should be performed. First, cut the jersey and undershirt in a T fashion, sleeve to sleeve, and down the middle from collar to waist. Second, cut the shoulder pad straps. And third, remove the face mask. When enough rescuers are involved, the helmet and shoulder pads can be fully removed. If head trauma is witnessed, then an athlete may be unresponsive due to a concussion or traumatic brain injury. For an athlete found down after a pileup where the mechanism of collapse is uncertain, rescuers should use their clinical experience to evaluate the athlete. SCA should be suspected if the athlete remains unresponsive, there is seizure-like activity or gasping, or a medical professional confirms the absence of a pulse.
No pulse. Start CPR.
All efforts should be made to minimize interruptions in chest compressions. Chest compressions are stopped temporarily while the AED analyzes the rhythm. Once the AED delivers a shock, we restart chest compressions right away.
Good. Tell me when they're on.
Pads are on.
Good. Stop CPR, analyze rhythm. Shock recommended, everyone stand clear. Good, back to CPR.
SCA can be differentiated from other causes of non-traumatic collapse, such as exertional heat illness or exertional collapse related to sickle cell trait. SCA causes a sudden collapse without warning or preceding symptoms. An athlete who suffers SCA usually appears normal prior to collapse, without signs of extreme fatigue, and is not struggling or unable to keep up. In contrast, both exertional heat illness and exertional collapse related to sickle cell trait typically cause symptoms prior to collapse, such as poor performance, falling behind, struggling, distress, loss of balance, or taking a knee. For heat illness and collapse related to sickle cell trait, the athlete is still conscious after collapse, although may be confused. We propose a universal response to SCA. SCA, or sudden cardiac arrest, should be assumed in the sudden non-traumatic collapse of an athlete. Remember to recognize, react, and rescue. Recognize sudden cardiac arrest. The athlete is collapsed and unresponsive to verbal stimuli, often with eyes open and rolled back, and brief seizure-like movements or gasping could also be present. React. Have someone call 911, retrieve the AED, expose and dry the chest, and ensure access to the airway, and clear the area of other players. Rescue. Start chest compressions, apply the AED, analyze the heart rhythm, shock as indicated, and resume CPR until the victim becomes responsive. For more information on recognition and management of sudden cardiac arrest in an athlete, you can visit uwsportscardiology.org. Thank you for your time.